I'm here with yet another topic of everyone's interest, that is high uric acid levels. This is an era of comprehensive health checkups or general health checkups, and we see people coming with a bulky general health checkup reports, and definitely uric acid is one of the parameters that get tested. And whenever there is a little increase in this parameter, there is a panic that spreads, whether it's something very dangerous, or am I going to get stones, am I going to get joint disease. So these are the concerns, those are voiced generally. So I would like to tell you what uric acid is all about. Uric acid is a byproduct of purine metabolism. Purine, as you all know, is an amino acid or a building block of proteins, and this amino acid gets broken down to uric acid. So whenever the uric acid becomes high, the normal values of uric acid being around 3 to 6 in women and 3.5 to 7 in men. So there are two factors that we need to look into, whether the production is high or the excretion from the kidneys is low. So these are the two things that would bring up the serum uric acid levels. So are all the high uric acids dangerous? No, definitely not. It is a part of the various lifestyle diseases that we encounter nowadays. We know that the various lifestyle diseases are diabetes, hypertension, dyslipidemias or high cholesterol, obesity. All these as a part of the spectrum of metabolic diseases, or what we call as metabolic syndrome, uric acid is always seen to be high. And this high uric acid can be now considered as a lifestyle disease. What happens when the uric acid goes up? One of the things is the arthritis part, which is of concern to everyone because the arthritis is very, very painful. The most commonly affected joint is the joint of the great toe. There is severe pain, redness and difficulty in walking that is encountered when one has a uric acid arthritis. And the pain is typically worst at night. And apart from this great toe joint, other joints that can be affected are elbow joints, the knee joints and the ankle joints. But every arthritis is not due to uric acid. There are so many other types of arthritis. You can have rheumatoid arthritis, so many other inflammatory arthritis. You can have osteoarthritis, which happens due to degeneration related to age. There can be arthritis or pain in the joints due to wear and tear. So every arthritis is not due to high uric acid. But these are certain locations where if one has an arthritis, the uric acid needs to be considered as one of the causative factors. We can have a serum uric acid test done. It may be elevated, it may not be elevated. Because the uric acid levels are not elevated, one cannot rule out that this arthritis is not because of uric acid. So uric acid can be normal and yet you can have a uric acid related arthritis. Other tests are, one can take X-rays, one can have scans which will show uric acid crystals within the joints. And the history is very typical. One takes a meal which is rich in purine, and the coming days one gets a bout of gouty arthritis or uric acid related arthritis. For example, one takes a dinner or a lunch which is rich in meat or some form of fish like prawns or tuna fish, etc. And the very next day you will have a bout of arthritis. I would like to especially mention the use of whiskey and beer. Of that, beer is the most notorious in precipitating a gouty arthritis. If we take the alcoholic drinks, wine has the least tendency to precipitate a gouty arthritis. Apart from arthritis, what uric acid does is creating uric acid stones in the kidneys or uric acid crystals. and some inflammatory processes in the kidney which lead to something known as interstitial nephritis, which can be dangerous at times. So the association between uric acid and kidney, if we look into, it can be a cause and an effect. Due to renal disease, the uric acid levels can rise, and due to high uric acid, renal disease may result. So there is a two-way relationship between the uric acid and the kidney disease. But having said that, every rise in uric acid does not bring about a renal disease. The uric acid rise has to be very persistent and unattended to cause a renal problem or kidney disease. So these are a couple of things that result from high uric acid levels. Now let us see how we can, in which population is uric acid generally seen, or is it high? So as I spoke earlier, we have the group where people have the metabolic syndrome or the diseases like hypertension, diabetes, dyslipidemia or obesity. In such category of patients, there's high likelihood of having a high uric acid as well. So definitely it can be considered as a metabolic syndrome, and so the remedies that we recommend are also similar to what is recommended in a lifestyle disease. Modification of the lifestyle, going on a purine poor diet, especially avoid a lot of red meat, avoid hot drinks, avoid sugared beverages, all soda containing and sugared beverages that go in with the junk food. All these are very rich in uric acid. Taking in a lot of fruits which are fructose rich can also result in a high uric acid. If we take the vegetarian items, well, the pulses and the normal vegetables that we consume are not so rich in purines, so one should not worry about taking these. In fact, one should take a fiber-rich diet which is poor in very simple carbohydrates, which is poor in fat, which is low in, a caloric content. So this is how one can prevent hyperuricemia or the uric acid levels going up. I cannot help mentioning regarding exercise, because that is one of the very, very, very important lifestyle modification one needs to make in order to curtail the chances of the uric acid going up. So putting everything in nutshell, uric acid is the product of purine metabolism. It gets formed in every person. It rises due to an overproduction. Overproduction, the reasons I told, sometimes a very purine-rich diet, some metabolic abnormalities, some drugs, which are especially used for high blood pressure. So these are the usual reasons. And poor excretion from the kidneys, that may be because of a kidney disease or some other reasons. So, and treatment, if we take, it is basically lifestyle modification. But in patients with renal disease, we may have to give long-term uric acid reducing drugs. In other individuals who have no renal impairment, we can give uric acid reducing drugs for a fixed period. And once the levels are low, we can stop and let them continue the lifestyle modifications forever. So basically, I would want to put across the point that this is also a lifestyle disease, and a healthy lifestyle to an extent can prevent uric acid from going high. Thank you.